enamel keeps the teeth intact through a combination of physics and chemistry. It is one of the strongest tissues in the human body. In simple terms, tooth enamel is kind of like a rock. It is made up of about 96% hydroxyapatite, which is a group of calcium phosphate compounds. For many of us, eating chocolates and sweets is a fun indulgence, but having a dentist drill holes in your teeth is a recipe for pain. Unfortunately, more sugar along with improper oral hygiene may be an express ticket to the dentist's chair. The tooth is made up of different layers with the hard enamel on the outside, protecting the dentine and the pulp on the inside. So have you ever thought, what makes the enamel so tough and protective for our teeth but susceptible to sweet and sugar? Although sugar does lead to cavities, it's not the sugar itself that's responsible for the decay. The bacteria that gobble up the sugar in the mouth are the problem. Let us now see the various ways in which sugar, bacteria, and enamel interact to cause dental caries. In this video, we will understand the three main theories postulated in the pathogenesis of dental caries. They include the Miller's acidogenic theory, proteolytic theory, and the proteolytic chelation theory. Dental caries has been defined as an irreversible microbial disease of the calcified tissues of the teeth, characterized by demineralization of the inorganic part and destruction of the organic substance of the tooth, which often leads to cavitation. The etiology of caries is a complex problem consisting of many direct and indirect factors. Fortunately, through many years of observation and investigation, numerous theories have been proposed. Let us now look into the theories. Early theories of caries focus on the genesis of caries that had been a folklore from the yonder. Various theories have been suggested in the past. Let's hop on to one after the other. The legend of worms. Dental caries was thought to be caused by worms living inside the tooth structure. There are a few endogenous theories like the humoral theory and the vital theory. The humoral theory is an imbalance between the humors or fluids of the body which causes the decay. What are these humors? They are blood, yellow bile, black bile, and phlegm. Vital theory, according to which tooth decay originated from within the tooth itself, basically like bone gangrene. Some exogenous theories would be chemical or acidic theory, given by Robertson, which proposed that tooth decay was caused by the fermentation of food particles around the teeth. Parasitic or septic theory, which proposed that although caries began purely as a chemical process, microorganisms continued the disintegration of both enamel and dentine. Although all these theories tried to explain the process of formation of caries, they were incomplete. Newly formed theories. Theory 1. The first theory, given by Willoughby D. Miller, is called the Miller's acidogenic theory or the chemico-parasitic theory. Till date, this is the most accepted theory. His theory states that dental decay is a chemico-parasitic process consisting of two stages. The decalcification of enamel and dentine as a preliminary stage, followed by dissolution of the softened residue. It may sound confusing, but is actually pretty simple. The enamel, which as mentioned before is the hardest tissue in the body, gets destroyed by the presence of acid. Are you wondering where this acid comes from? Well, it is derived from the fermentation of starches and sugars which get lodged in the teeth. Miller assigned the role to three factors in the carious process: the oral microorganisms in acid production and proteolysis, the carbohydrate substrate, and the acid which causes dissolution of tooth minerals. Let us see the action of each one by one. The role of carbohydrates. One of the main causes of caries is the presence of readily fermentable carbohydrates, which leads to decrease in caries resistance. Studies showed that when teeth were incubated in mixtures of saliva and bread or sugar, decalcification occurred. But there was no effect on teeth when meat or fat was used in place of carbohydrate. This simply strengthens the fact that a carbohydrate-rich diet is more prone to caries. Karyogenicity of a carbohydrate depends mainly on frequency of ingestion, physical form, chemical composition, route of administration, and the presence of other food constituents. Simply put, bacteria plus sugar plus teeth will lead to organic acid production, therefore destruction of organic and inorganic components of enamel, and thus dental caries. Role of microorganisms. As you must be aware, the oral environment is capable of hosting a plethora of microorganisms. Miller demonstrated the presence of microorganisms within the dentinal tubules in the teeth. Some of the organisms seen are Leptothrix, cocci, Streptococcus mutans, and Actinomyces species. One or more organisms are implicated in the initiation of caries, while other distinctly different organisms may influence the progression of the disease. Role of acids. How are these acids formed? Sugars undergo enzymatic breakdown, which leads to the formation of chiefly lactic acid, along with some amounts of propionic acid and butyric acid. Acids formed are localized on the surfaces of the teeth. This causes demineralization of the enamel, which eventually leads to dental caries. The drawbacks of this theory. This theory couldn't explain the predilections of specific sites on the tooth to caries, and it could also not explain how some populations are caries-free and phenomenon of arrested caries. The second theory. Think of your teeth like a fence post. You want a lot of cement around the post to keep it strong, sturdy, and intact. If you lose even some of that cement or organic elements, then the tooth can become weak. Gottlieb and Gottlieb, Diamond and Applebaum suggested the dental caries is essentially a proteolytic process in which the organic or protein elements are the initial pathways of invasion by microorganisms. Enamel lamellae are the initial pathways for spread of caries, and this theory was called the proteolytic theory. Was that too confusing to understand? As we learned before, enamel is composed of organic and inorganic matrix. This theory basically says that the organic portion gets attacked by lytic enzymes. This leaves the inorganic portion without a matrix system, causing it to be destroyed, creating cavities. Acid formation occurs along with proteolysis, leading to yellow pigmentation, which is a characteristic feature of caries. The pigment is produced by proteolytic organisms. The drawbacks of this theory would be that no satisfactory evidence was provided to support that initial attack was proteolytic, and some studies showed caries occurred even in the absence of proteolytic organisms. Thus, to conclude, proteolysis in the initiation of dental caries is likely to be of no significance, but its role in progression of the more advanced carious lesions cannot be ruled out. The third theory, the proteolytic chelation theory, given by Schwartz et al., implied a simultaneous microbial degradation of the organic components and the dissolution of the minerals of the tooth by a process known as chelation. It can be thought of as tender coconut, with a hard outer surface and a fleshy inner mineral component. To get into the inside, the outer shell has to be broken, so the outer shell formed by inorganic components is destroyed. Simultaneously, the flesh formed by the proteins is also destroyed. Now, what is chelation? It is basically a process involving the complexing of a metallic ion to a complex substance through a covalent bond, which results in a highly stable, weakly ionized compound. This theory considers caries to be a bacterial destruction of teeth in which the initial attack is on the organic components of the enamel. The breakdown products have chelating property which dissolve the minerals present in the enamel. Soluble chelates are formed within the mineralized component of the tooth, which leads to decalcification of enamel at neutral or alkaline pH. This theory resolves the conflict as to whether the initial attack of caries is on the organic or inorganic portion of enamel by stating that both are attacked simultaneously. If you have stuck with me till now, I'm sure you enjoyed the video. Please do like, share and subscribe to the channel as it makes up for all the time and effort we put in to make concepts so simple and easy just for you. Hoping to see you in the next one. Until then, on your marks, Medi Study Go!